Hello, Harry Brownlow, shoulder specialist. Today I'm going to talk to you about risks and complications associated with the operation of open reduction and internal fixation of collarbone, or as we sometimes describe it, ORIF of clavicle. Now, for the vast majority of people, this is a straightforward procedure without any risks or any major complications. But it's worth bearing in mind that just rarely things can and do go wrong, and these need to be thought of before you finally consent to your operation. The first complication to consider is infection. This is uncommon. It would happen in about maybe 1 or 2 in 100, so 1 or 2%. And we use techniques, and including giving you antibiotics as you go off to sleep, in an attempt to minimise the risk of you developing infection. But if you do develop infection, it can be a real problem. It's not simply a matter of taking some simple tablet antibiotics. More usually, it would require a return to the operating theatre, perhaps even a removal of all the plate and screws that were put in before, and a prolonged period of antibiotics. So while it's an uncommon problem, when it happens, it can be very difficult to treat and hugely disappointing for all involved. The next complication to consider is nerve injury. Now, I think there are two forms of nerve injury. There's an inevitable nerve injury of the small nerves in the skin, such that you will have a little numb patch in the skin on the top of your chest underneath my scar. That's because there are tiny nerves in the skin that get cut when I do the operation that render you with a funny feeling at the top of the chest. Now, the nerves will in time grow back, but it may take many months to do so. The second and much more important, but thankfully much less common, is that of serious nerve injury affecting your arm and hand. This could, of course, be permanent. I don't think I've ever encountered this in clinical practice, but it is well described in the literature, and therefore it could happen to you and is something to bear in mind. The third issue to consider is metalwear problems. Some people just don't like the plate on top of the collarbone. Usually this is particularly so in people who are slim or who have very prominent collarbones. Perhaps you don't like the look of the little plate underneath the skin. Perhaps you don't like the feel of it. Perhaps you don't like the rubbing of a rucksack strap or your seatbelt over the plate. Perhaps it's making you sensitive to the cold. For any or all of these reasons, there might be a reason to take the plate out in the future, but I would never allow you to have the plate taken out for at least a year after it was put in, until we are 100% sure your fracture is solidly healed and can withstand having the plate taken out again. The next complication is an odd one. It's called non-union. Just very uncommonly, despite everyone's best efforts to put everything back together again in the right place, the bones choose not to heal. Thankfully in the collarbone this is not a common problem, and indeed it's more common in people who do not have the operation than those who do have the operation. If you don't heal, we should be able to recognise that on a simple x-ray, and you may very well require another operation to encourage the bone to heal. But with the modern plating techniques, actually this has become quite an uncommon complication. Another complication to consider is stiffness. Sometimes after having had a nasty injury and then perhaps being in a sling for a period and then having an operation is an opportunity for the shoulder to tighten up. But with the new modern plating techniques and our ability to get your arm moving straight away after surgery, I don't think we see as much stiffness now as we used to. If you are unlucky and do develop stiffness, it can be treated either by waiting for it to resolve itself naturally. That will happen, it's slow but it will happen. Or there are minor procedures that can be considered at the time and worth discussing with your surgeon. And one final thing to mention, which again is very rare, is that it is possible to puncture the lung when doing the operation. The deflation of the lung will cause you to be breathless, but it will happen immediately after surgery, and you will be recognised as having had this complication in recovery, and we can deal with it there and then. So those are the main risks and complications of what otherwise is normally a very simple and straightforward and successful operation. Thank you.